Hello everyone, myself Mr. Nitin Nirmal, Assistant Professor Dr. Vitthal Rabike Patil Foundation, College of Nursing, Nagar. Today I am here to talk about the important topic that is depression. Introduction. Depression, it is the most common mental disorder, and the lifetime risk of depression, it is 8 to 10% in male, and it is female, it is 24 to 26%. Depression, it is the second leading cause of death after the cardiac arrest. The next is definition. Definition of depression. Depression, it is the type of mood disorder and it is characterized by low mood, sad mood, loss of interest in all activity throughout the day for at least 15 days or more, and that can lead to the impairment in the day-to-day activities called as depression. Then next is etiology of depression. Etiology of depression that mainly includes biological theory, then psychodynamic theory, cognitive theory, behavioral theory, and sociological theory. So one by one we'll see. First is biological theory. So according to this biological theory, the depression, it is mainly due to the according to this biological theory, this mainly includes neurochemical theory, genetic theory, endocrine theory, circadian rhythm cycle, and neurostructural theory. So first is neurochemical theory. So according to this neurochemical theory, the depression, it is mainly due to the alteration in the level of neurotransmitters, that is serotonin and norepinephrine, that can cause the depression. Then second is genetic theory. So according to this genetic theory, depression, it is most commonly seen in first degree relatives than the general population. First degree relatives having 10 to 15% of chances of developing the depression. Then second is twin study. Twin study or identical twin study shows that if the one twin is diagnosed with the depression, then second twin is having around 70 to 80% of chances of developing the depression. Next is endocrine theory. So according to this theory, the hypothalamic pituitary adrenal axis, it is a system in our brain that mediates the stress response. If the individual is experiencing this endocrine, if the person is experiencing this system malfunction, then that can create the cortisol abnormality, that is stress hormone. Then next is circadian rhythm cycle. Circadian rhythm cycle, it is responsible for our daily regulation of sleep-wake cycle, arousal pattern, activity pattern, and hormonal regulation. If the individual is experiencing this circadian rhythm cycle changes, they are at high risk of developing the depression. Then next, changes in brain anatomy. So according to this theory, the loss of neurons in the areas of the brain, that is frontal lobe, cerebellum, and basal ganglia, that can lead to the depression. Then next is psychosocial theory. So according to this theory, the depression, it is mainly due to the loss of a loved one or the fixation in the oral stage of psychosexual development that can cause the depression in later life. Then next is behavioral theory. So according to this theory, the depression connects the depressive phenomena to the experience of uncontrollable events. According to this model, the depression is conditioned by the repeated losses in the past. The next is cognitive theory. So according to this cognitive theory, the depression, it is mainly due to the negative cognition, that is negative expectation about the self, negative expectation about the future, and negative expectation about the environment. The next is sociological theory. According to this theory, the depression, it is mainly due to the stressful life events. For example, divorce, death, marriage, financial loss, or any serious medical illness like HIV/AIDS and cancer. Then clinical features of depression. So clinical features of depression that mainly includes depressed mood, that is low mood, sad mood, loss of interest in all activity throughout the days. Okay, then next is depressive cognition, that is hopelessness, helplessness, worthlessness. So these are the trial symptoms. Hopelessness means the person feels that there is no any hope in the future. Helplessness means the patient feels there is no any help available, and the worthlessness means a feeling of inadequacy or the inferiority. Then next is suicidal thought. So these ideas of hopelessness are often accompanied by the thought that is the life is no longer worth and the death had come as a welcome release. Then this gloomy preoccupation may progress to thought of plans for the suicide. Then next is psychomotor activity. So in depression, there is retarded psychomotor activity. The retarded patient think, walk, and act slowly. The slowing of thought is reflected in the patient's behavior. The patient may answer the question after the long delay. Then next is psychomotor, psychotic features in that delusions and hallucination is also the most commonly seen in depressive patient. Then treatment modalities. In treatment modalities, psychopharmacological treatment, in that antidepressive drug and antipsychotic drug is most commonly given. So in antidepressive drug, mostly the selective serotonin reuptake inhibitors, that is SSRI drug, then tricyclic antidepressive and monoamine oxidase inhibitor drug are most commonly used. So in SSRI, selective serotonin reuptake inhibitor, in that citalopram, fluoxetine and sertraline, these are the most commonly used SSRI drug. So this SSRI drug acts by blocking the serotonin, blocking the reuptake of serotonin at the postsynaptic receptor. So next is tricyclic antidepressant, in that amitriptyline, clomipramine and imipramine. These are the most commonly used tricyclic antidepressive drug. And the last is monoamine oxidase inhibitors, in that isocarbaxide and phenelzine. These are the most commonly used monoamine oxidase inhibitor drugs. Then is antipsychotic, in that antipsychotic drug, it is also most commonly used in depressive patient if the patient is showing the psychotic symptoms like hallucinations and delusion. So to treat the psychotic symptom, antidepressive drug like typical antidepressive drug haloperidol, trifluperazine and chlorpromazine. So these are the typical antipsychotic drug, and the atypical antipsychotic drug, in that mostly the olanzapine, clozapine and risperidone. So these are the atypical type of antipsychotic drug. These drugs acts by blocking the D2 receptor at the mesolimbic and mesofrontal cortex. So this is about psychopharmacological treatment. Then next is physical therapy, in that electroconvulsive therapy, that is called as ECT. ECT, it is mainly indicated in depression. If the patient with severe depression with suicidal risk, in that case the electroconvulsive therapy, that is ECT, is most indicated. Then ECT also, it is also indicated if the patient is not responding to the drug therapy and psychotherapy. In that case, the electroconvulsive therapy, it is a life-saving and very effective treatment. Then light therapy, sometimes called as phototherapy, that involves exposing to the patient to the artificial light source during the winter season to relieve the seasonal depression. The next is psychosocial treatment, in that psychotherapy, cognitive behavioral therapy, supportive psychotherapy, group therapy, family therapy, and behavioral therapy. It has also the important role in the treatment modalities of depression. The next is nursing management. In that nursing assessment, first is assess the baseline data of the patient, then assess the history and mental status examination, assessment of suicidal risk, in that ask patient directly about the suicidal thought, they assess the plan, method and intent, then history of previous suicidal attempts and presence of any hopelessness. Okay. Then next is nursing diagnosis. In that first nursing diagnosis is high risk of self-directed violence related to the depressive mood, feeling of worthlessness and anger directed inward to the self. The second diagnosis is powerlessness related to dysfunctional grieving process, lifestyle of helplessness evidenced by feeling of lack of control over the life situation. And the last one is altered nutrition less than body requirement related to the depressive mood, lack of appetite or lack of interest in food evidenced by the weight loss or poor muscle control. Thank you. So this is about depression.